Lake Belton.
Lake Belton.
Man, it was bad coming through Fort Worth last night. I was driving from Fort Worth, and man, it was hydroplaning.
Yeah.
It was all over. I'd never seen it. I think I saw 12 accidents maybe just driving through in 20 minutes.
I was watching radar, it was much heavier there.
It must have come down like all at once.
Yeah.
Because I'm talking corn.
I do have a quorum.
You want to go ahead and start?
Yes, sir.
Recording in progress.
All right, let's call to order the McLennan County Rural Transit District Board of Directors meeting. Proof of posting, please. Or it was posted properly. Oh, go ahead, Jeff.
29th at 4 p.m.
All right, thank you. Okay, did anybody zoom in? I don't guess they did.
Just us two.
No, so Judge, it's just me and Cody on Zoom.
Okay, good. I don't feel alone. Those are my security blankets. All right, so you should have received your minutes. Are there any questions about those?
Nope.
Not, is there a motion to approve the minutes?
So moved.
Second. Motion made and second. All in favor say aye. Aye. Opposed, passed. Okay, operations report, ridership programs, revenue, expenses, equipment, marketing plans, and related matters.
Yes, sir. You have it? It's on the table. I saved it on the jump drive just in case. I know Cody usually will send it to you. Apologize, Judge.
That's all right.
But we do have some good news. We are trending up
Yay.
as far as ridership goes. We actually did some McLennan County Rural Transit District outreach in the month of September and October. We went to Crawford. We passed out some flyers and magnets that we provided to City Hall. We went to the convenience store, the Family Dollar, the Senior Center. And so we kind of wanted to put some information out about that we do come to that area. And a lot of individuals in that area didn't know. We will be going back to the Senior Citizen Center in Crawford, so a small building, just so we can reach out to them. But it was closed when we went. We went out to Moody. We passed out some flyers and some magnets with our quick information. We passed that out to City Hall. There was one restaurant there, but it closed at 2, so we didn't get a chance to stop into there. But we dropped off some flyers with the Brookshire Brothers convenience store. We also passed out magnets so they can give them to the patrons. They were excited about that because they said it might help stem their business by getting people to use that service to come to the Brookshire Brothers there. And we also went to the Housing Authority. Their office was closed, but we did place some magnets and some on the residents' doors. We went out to McGregor, and we then talked to the Brookshire supervisor, gave him flyers, magnets, put some by the registers for individuals in the community so that they'll know that we do come to that community and provide that service. McGregor, we went to the Housing Authority. We passed out flyers and magnets to that community, talked to the residents about the scheduling process. And we also went to the McGregor Senior Living Center and talked to those residents, and they were interested in being able to use our service to get to grocery stores and things like that. So we really want to extend our outreach this year. All right, now our numbers are up. And just so everybody knows, you can see that our line is the kind of greenish turquoise one. So we're not quite 2020 numbers, but you all know that we've been trying to gain our employee base. We're building on that, and we did receive some additional funding from TxDOT for an extension program. So they're really happy with our current performance. If you go to the next slide, please. Here are the actual numbers so you can see them in comparison to last fiscal year. We did not update the numbers through August and September because this meeting had been rescheduled. I reached out to Cody. She told me let's move forward with this. But just so you know, running numbers, we're estimated to be about 75%. We're actually looking at about having 25% of our actual budget still remaining after this fiscal year. And so just so you can see, our numbers are trending up. We're just not where we were pre-COVID, but we are doing better based off of just different factors in the community, and our wage increase is helping as well. Next slide, please. This is our commuter route, and so we are redesigning that, relooking at that. We go out to RESO, and so we really want to build ridership in the areas where there's a niche for a gap in transportation. And so we're talking to the community leaders, community organizations to kind of build that commuter route. Next slide, please. And this is the commuter route comparisons, and you all are aware of the change that happened back last October with regards to Falls County, but we are trying to build those numbers back up. Next slide, please. This is just showing the commuter route in addition to adding in Sanderson Farm. And Sanderson Farm does a big hiring campaign in October and November, so we always experience a significant growth in that ridership during those months. Next slide. Any questions about the ridership numbers?
Questions?
Questions about outreach? All right, I'll do finances.
Okay.
They're not on that Gov drive. Did everybody receive a copy of the budget?
I have it.
I'm sorry, it's not on that.
It's in the package, I believe.
It's in the packet? Okay, thank you. So what I want to be able to just talk to you guys about is that this, if you look at the rural state, it appears as if we are over. However, we had some funding that TxDOT allowed us to extend out, and it rolled over until October of '24. So we'll be adding in an additional $640,000 on that rural state grant, which will put us under the budget. So, and you all know, we proposed these budgets initially based off of our projected grant allocations. And so once we get the actual numbers, we update it, but we will be under budget on that rural state. If you go down to the 5339 bus and bus facility line, we also have we also able to roll over $66,000 that was left from the vehicle purchases. And so those funds won't expire until February of '24. And so we're looking at making sure that we have our radios and the technology items that we need on those vehicles that we purchased. Some of those things were back ordered, so it allowed us to carry that money over in order to make sure we get the equipment to utilize our fleet as it's designed. Other than that, as of July, we're at about 55% of the budget. At the end of July, we're still on track to finish. Again, we are sitting at about 62% of estimated budget expenses. And so looking at a little over 25, 26 when we end out the year. We have no ratifications today. We're sitting well. We are getting increased funding from TxDOT. They're looking at McLennan County for an expansion program of services. And so we really need to be engaged with these individual communities that our board members are a part of, our commissioners, because we need to grow our service delivery, and we want to meet that unmet need that may be out there. So if you think of anything, if you need anything, please reach out. I can come do talks with different organizations within the community. We've talked to the Kiwanis, we've done some different groups, and so please reach out if you think of something. But please know, I did get your contact information from Cody, so I'll probably be reaching out to see if there's something specifically you would like us to do, and try to work up an action plan so that we can have some great deliverables this fiscal year. That concludes my ridership and finance report, Judge Becker.
Okay. You know, the started construction on the new, what's called a work site, which is a training center out in the industrial area. And one of the challenges we see, to be sure that the location of that is to make it real, handy, for the industries out there that reskill and upskill their workforce. But it also will be used for entry level too. So, getting transportation from all different areas to that spot, and to that area, could be important. Now, that facility won't be finished until, the end of next year. But in planning for the future, that is, there's two issues, transportation and daycare, that we think are important for the industrial area. And the tough one is daycare. It's hard to find somebody who wants to take that on, and there's a lot of risk with it and all those things. But that is something that we need to look at.
I'll reach out to Dustin and try to get some contact information so we can at least put it in the planning process.
Yeah, I think probably in working on that too, probably if we can engage with all the cities in the county, and work towards making sure people that live in any town within our county can get to any work spot is important. And so having those remote pickup sites and those things are going to be important. And kind of brings me to a question. I know we look for trying to find drivers is one of the issues. I know the Mart area and Riesel area and through there. Have we had any luck in that regard?
Well, we've actually, we implemented an on-site, an application process where people could fill it out online, because everybody used to have to come to Waco Transit, fill it out and go through that. So since we've implemented our online application process, we have seen a significant increase in applications. We've increased our processing time. And so we are in a position where we have been able to get more drivers. They're not in a specific community like how we wanted to do
Yeah.
Mart and kind
Yeah.
of pulse in. I think it's still the drive, but I think if we could get some ridership in those areas, that would, substantiate us having a vehicle stage there to provide services within that area.
Right.
I think we could provide a cost-effective service, but we need to make sure we have the ridership to, support having a vehicle there, because if not, it's gonna deadhead from west all the way back into Waco.
Yeah.
And so then you've lost money per se, because
Right.
you have that transit in place.
Yeah.
So, but we're doing a lot better on applications. Again, our salaries for our we went up to $15 on those, and then we will train them to get a CDL so they can do both sides of the service delivery. So we have had a significant increase, and so we're doing a lot better. I think that COVID, and I don't know what they were doing for that time, but it seems like people are needing to come back to work, and
Yeah.
and so we're happy.
So that brings up, when you talk about the CDL, what size vehicle has to qualify for what? In other words, what's the?
Our 35-foot buses, anybody who drives the rural service, they only drive the vans, and there's not a CDL required for that service delivery, Judge.
Oh, so like a van that's under that
Yes, sir.
does not need that.
Yes, sir, it's about the weight of the
Yeah.
vehicle, but our service, you don't have to have a CDL for.
Yeah.
We try to recruit like retirees, we try to do like work-life balance schedules, if somebody just wants to come in 2 days
Right.
out of the week because they receive Social Security and they don't want to work over a certain amount of hours,
Yeah.
we try to do lifetime scheduling, so that they can still receive the benefits and not go over. So we're really trying to be creative to bring in people who just want to get out the house, work, but not be on an 8 to 5 all day, every day. And so that's really working to our benefit as well.
Is work the biggest reason that somebody needs ridership?
No, a lot of our people, our service is for people who can do anything. I mean, you can go out to eat and go get your hair cut. And so medical, we have a lot of dialysis in the rural counties. We have a high medical ridership population, but we also have a lot of people that come into the town to go shopping, quality of life, visit people at the hospitals. So it's really a wide range. I would say if I had to weigh it heavily, I would say it would be more focused on those going to dialysis, those type of activity centers. If you have a child that has a cognitive disorder, we get a lot of ridership from those type of passengers as well. But I can't say work is the driver for the rural system. But a lot of them come in and feed into our fixed route system, so it may be with those individuals, but.
So I'm here on behalf of Lorena, and I have to be careful not to speak for my organization while I'm here, but there's CMS stuff is coming up, right? We're going to have to start focusing on social determinants of health. We don't have a choice not to. And transportation is one of those things we're
Right.
going to have to start focusing on. We're going to have to ask the questions. We're going to have to start documenting on it. We're going to have to start reporting on it. So I think that there's probably going to be a big opportunity to partner with the healthcare organizations in the city to
Well,
increase
let's
the
reach out.
numbers.
Yeah, let's
and refer-
connect and figure out an action plan and execute.
Well, I know Waco Family Medicine, I think I don't know if there's probably not dedicated routes there, but there's,
So we have a stop, we have a bench that we work with them to put in front of that facility.
Yeah.
For the individuals that use it. So, I mean, we use the system to connect and create that link. We just need to know what we need to do and get creative and make it happen.
And I think, in addition to dialysis, I think your heart failure patients are probably your next big bucket that need a lot of help.
And a lot of times they just don't know we're an option.
Yep.
when you mentioned that TxDOT would like for us to expand our services, does that come with funding? In other
It
words, if you
does.
come with the program, in other words, you come with a plan and you present it to them and it meets their criteria, then the funding would come with it. Is that what
Yeah,
you're saying?
the state received some additional funds, and so they sent out an email and asked us if we felt like we could expand our service delivery. And we were very confident. We had our staffing levels up, and it just increases the revenue, the funding that we receive for this program. So we're never going to turn down an opportunity to expand what we're doing. We just have to get in the communities, do a deep dive, figure out where the unmet need is,
Yeah.
and then make sure that we can capitalize on that. But if the money's there and it can benefit McLennan County, we're going to go after it, Judge.
Right,
And we did, and we were awarded, and we'll be meeting monthly with my staff on KPIs so that I can make sure that we're gauging that growth so that we can continue to sustain those areas. And they offered us a pretty good amount of money to participate because they don't want to give the money back to the feds, so.
No. No, that's right. Well, I just feel like that, we've done a lot in the last several years. There's been some changes, with the Falls County switch and that kind of stuff. I don't think, they're not providing the level of service that we provided before. And I don't know how pleased everyone is with that, but we can only control what we can control. But I don't know, sometimes I feel like that we need to get more community involvement to, have a couple-hour meeting or whatever it takes to get people to kind of weigh in and say, yeah, this is what, or we say, this is what we provide, what y'all's needs are, but have everybody in the same room so you could have a master plan. And maybe the reason for the meeting is because TxDOT is offering support to expanded services. And maybe that would bring communities in, the Marts and the Riesels and the Hallsbergs and the McGregors and Lorenas and everybody in.
See what their precise needs are.
Yeah, yeah.
Right,
yeah.
because we can put out a pre-prescribed plan as to what we need to execute, but that may be my perception of what their community needs. It may not necessarily meet their individual needs. And so that's why we've been actively out in the community, and I plan to provide you all, at each board meeting where we went, who we visited with, and what we did, so that you can see that, we're putting the message in the community. And we just need your help to continue to advocate for us and let them know we're here.
Yeah, so maybe we can do a public transportation summit of some sort, that you know, Waco's got a more defined because the population's dense and those things about how they serve within their area. And we need to try to develop something
Yes, sir.
to help all the other communities have
Okay, well, I'll
a
put
more
some
efficient
things.
service. I don't know, be thinking y'all, any of y'all think about, you know, what ideas might come around to have something really focused on that and set some expectations and those things.
Yes,
Yeah,
sir.
and maybe I'm trying to think, you could contact the mayors of these or the chambers.
Well, I think mayors and city managers
Yeah.
probably to start out with.
And then just some awareness deal, just here's our product, well, it's available, make sure you.
You know, where are we meeting your needs?
Yeah.
Right.
And where we may be meeting the needs of, let's say, McGregor, we might not be meeting the needs of Lorena or eastern part of McLennan County or whatever, but west, you know, there's a population, but it's got a little bit of distance out between it. But a population that's, I would say there are probably a lot of aging people in that community that could, you know, that could really use getting in for.
Do we have a free pass program at all?
No, sir.
You know,
No, we don't. It's,
handing out some free passes
Voucher type deals or
Yeah.
something?
may,
Introductory offer.
yeah,
Well,
first ride free.
so Indigent Health, our Indigent Health group does hand out,
Right, they
Some
have,
of those.
they have bus passes.
Yeah.
So,
and,
and the deal is with the rural system, the fare doesn't cover the true cost of the service that we do.
No,
So-
no.
So when you put it out there, you got a free opportunity, you know, we really wanna, you know, kind of sell the customer experience and, you know, how it creates more accessibility for your need, but, cause sometimes you get somebody on free, and then the next time it's like, well, I didn't have a, you know, so it's kind of hard to kind of take away when you give it. So, but I get it, you know. So we try to reference them to an entity that may be able to help them. And
That's what
provide
I
our
wouldn't
resource.
necessarily, I would like give those free passes. You know, you give a free pass maybe to a dialysis clinic or or something, or,
ER
or,
or something.
yeah, somebody, you know, some, be real strategic about it.
And I think with dialysis, they get a portion of their funding in the
Is
in the
that
whole-
one of those 53 whatevers? Is that one of those, are those transportation costs covered by
Yes, sir.
Medicaid?
Yeah, yes, sir. They have, and we do provide Medicaid trips. And so the difference with the
Yeah.
Medicaid trip is, you know, they pay you a higher rate. They'll pay you, you get about $23 for that Medicaid trip versus the $350 for the private pay trip. So we've increased our Medicaid trips as well to kind of have that local match, because we can't forget that we may get the grant money, but we still have to have that local match side to pull it down. So that's why we try to really focus on that advertising and little extra things, because, I mean, I can get all the money in the world, but if I don't have a match to pull it,
yeah,
I can't act, you know, I can't utilize it, so
yeah.
we try to
Okay.
find a balance.
I found out something today that, because Waco Family Medicine is a specific designation, what's it called?
Federally,
Qualified
Fe-
health center.
Yeah,
FQ.
HC.
yeah,
Yeah,
FQHC.
uh-huh.
They get a higher Medicaid match than like Providence or others. Therefore, that group, that location could be a double whammy positive, because you would get a higher, your Medicaid trip reimbursement would be higher with those folks, and then they get a higher return as well. And so maybe if we start talking about strategic planning countywide, that, you know, they're involved in that discussion as well. So, I mean, we got so many things to deal with that are important. It's just hard to get them all in the road, but. any other ideas or thoughts that we need to be looking at, maybe we're not looking at now? Okay, anything else to come before the group? Is that all we have on the agenda, I believe?
That's all we have, sir.
Okay. In regards to the time, we've done a 4 o'clock and we've done a 4:30. What, is either one of those times better for, or not, make any difference to anybody?
Either one works for me.
Yeah, same here.
Okay.
Whatever you request, we'll be here.
Well, we may do, Dustin, let's think about a 4 o'clock because, we've got security that generally leaves at 5 and so if we, especially if we start expanding and more discussions and getting some people in here to talk about what their needs are, let us kind of do that. I'm gonna try to have something for the next meeting on that, so. All right, anything else to come before the group? All right, we stand adjourned.